All right, good evening, ladies and gentlemen. So we are just about to start. So this webinar, GyneFert webinar, is being presented to you by Vivagest. So Vivagest is a superfood supplement that, sorry. I'll be very happy if we can all kindly mute ourselves, the exception of the two doctors who will be doing the presentation this evening. So if you can kindly mute yourself, I'm very, very happy. Yes, so as I was saying, this presentation is brought to you by Vivagest. Vivagest is a super food supplement for pregnancy. It is taken for those who desire to get pregnant, those who are already pregnant, and also for breastfeeding mothers. So without wasting my time, I will introduce the two speakers for today. Then I'll hand over to them, then they'll start. So today we are very lucky. We are blessed, as a matter of fact, to have two medical doctors going to do the presentation for us. So it is like 2 in 1. So our first presenter, or one of the presenters, is Dr. Nana Poku. Dr. Nana Poku is a medical doctor, a passionate advocate for women's health. She's the co-founder for Cervical Foundation, a non-profit dedicated to raising awareness, educating communities, and also advocating for resources to prevent cervical cancer in Ghana. With a background in medical education and a strong commitment to public health, Dr. Nana Poku works to inspire action and foster meaningful conversation about cervical cancer prevention and early detection. So other speaker for today too is Dr. Cudjoe, Dr. Frank Cudjoe. Dr. Frank Cudjoe too is a medical doctor and a co-founder of the Cervical Foundation Ghana. He's also a healthcare data scientist. So as I said, he's the co-founder for Cervical Foundation Ghana, which is a non-profit committed to eliminating cervical cancer through education, advocacy, and accessible prevention care. Beyond his work with cervical, Dr. Cudjoe is deeply engaged in global health and health informatics, leveraging data-driven solutions to address critical healthcare challenges and also reduce health disparities and enhance patient outcomes. So before they do the presentation probably they'll spend some few minutes and talk about their foundation and what they are actually doing to help women. So without wasting my time, I'll hand over to you two doctors. I don't know who want to start first, but I'll hand over to you. So take over the presentation. After the presentation, I'll come back so that those who have questions can ask. Thank you very much. So let us all enjoy.
Hi everyone, thank you so much for the introduction, Vivagest Ghana. My name is Doctor. Please, am I audible?
Yes, please. There's some small noise. I don't know where it is coming from. Whether it is coming from your place. If you can kindly or we.
I think it's from Victoria.
Ourselves.
Okay. Okay, great. Okay, I believe I'm audible now.
Yes.
Great. Thank you so much for the introduction once again. It's truly a pleasure to grace this platform and to have the opportunity to share with you, or as a matter of fact, about cervical cancer. By way of introduction, as already mentioned, my name is Dr. Frank Erzoah-Cudjoe, and I am the co-founder of Cervical Foundation Ghana, together with Dr. Kelyne and Poku. And just briefly about what we do. So we have the goal of eliminating cervical cancer here in Ghana, and we Our mission is to empower women and communities with knowledge and advocate for accessible resources for prevention and, engage in partnerships that would reduce the burden of cervical cancer in Ghana. And to that effect, the areas that we are focusing on is by building a lot of awareness through education programs and campaigns to advocate for the HPV vaccination, which we'll talk more about as we go on, and to also advocate for early screening and detection, community engagement, finally, to help, create and adopt policies in the country that would help make eliminating cervical cancer achievable. And once again, it's an honor to grace this platform to share with you all we can about cervical cancer. So I'd like to share my screen. I don't know if that's available. Let me see. Great. I think I can do that. Coming. Okay. Please, can you see my screen?
Yes, I can see it here.
Okay. Is it in presentation mode?
Yes, please.
Yes.
Okay. A minute, please. Let me see. Is it still in presentation mode? Oh, I think the scratching sound is back. Hello?
Yes, we can hear you. We can hear you.
Okay, sure. Okay, please, is this still in presentation mode? Or if you could tell me what you see, I would be really grateful.
No. Oh, please, it's not.
Okay. And is it it's not on presentation mode? Is it currently showing the slides or showing something else?
No, it's showing Zoom. The Zoom.
Okay, that's fine. Okay, so let me put it in presentation mode. All right. So once again, this presentation is brought to you by Cervical Foundation Ghana. So what is cervical cancer? When we talk about cervical cancer, we're looking at it's just abnormal growth of cells in the cervix. So when there is uncontrolled growth of the cells that are usually found in the cervix. Now, when we talk about the cervix, we're looking at the neck of the womb or the part of the female reproductive system that connects the womb or the uterus. Can you see my pointer, please? If you can see my pointer.
Yes, please.
All right, yes. That connects this part of the female reproductive system. That's the womb with the vagina. And this is what we're talking about, the cervix, right? It's also called the neck of the uterus. Now, when the cells of that part of the female tract, the cells they grow abnormally, then that's when we have what we call cervical cancer. Now, cervical cancer is caused by, it's an abnormal process, and there are so many risk factors that can lead to the development of cervical cancer, and I'll touch on a few. But by way of epidemiology, I would like for you to know that it's the fourth most common cancer among women globally. Right, and that's important to note. And when you come to Ghana too, it's the second most common cancer among women in Ghana, only second to breast cancer. And I think that's very important to know. In the year 2020, it was estimated that around 2,000, or let's say close to 3,000 women were diagnosed with cervical cancer here in Ghana. And out of that, about 1,619, or about 1,800 of them died from cervical cancer, which I think is very important because these numbers grossly underrepresent the actual number of people suffering from cervical cancer and dying from it because of low level of awareness and knowledge among Ghanaian women. Now, the interesting thing is with the global statistics, in the year 2022, 660,000 women were diagnosed, new cases of cervical cancer were diagnosed, right? And out of that, we had about 350,000 of them. These are global statistics and not just for Ghana. 350,000, almost half of that number died. Now, it would interest you to know that 9 out of 10 of the women that died from cervical cancer in 2022 globally were from low and middle income countries like Ghana. And that's very alarming. It means less than 10% of the people that actually died from the condition were from developed countries. And these are some of the reasons why we are doing what we do to improve the level of awareness and knowledge among women here in Ghana, so that the measures necessary to be put in will be put in so that people don't die from cervical cancer. Now, so there are risk factors that make or that puts a person at, that gives a higher possibility or probability of a person developing cervical cancer. And the first main risk factor is a persistent infection with human papilloma virus, to be specific, the high risk type. Now, human papilloma virus is a sexually transmitted infection or virus, right? And there are so many different kinds or strains, as they are called. And about 80% of sexually active people already have human papilloma virus. But then not all of them are at risk of developing cervical cancer, because there are some specific strains of human papilloma virus that actually increases a person's chances or a chance of developing cervical cancer. And to be specific, we have HPV 16 and 18. Those are two main culprits. Now, if a person is infected with the human papilloma virus, the human body or the immune system does a very good job in clearing the virus within 2 years. However, if for one reason or another, the body is not able to clear that infection, then or someone keeps getting infected with the high risk types of the human papilloma virus, then that person is at high risk of developing cervical cancer. It is the single most determining risk factor for developing cervical cancer, right? And that's important to know. So the picture on the right from Cleveland Clinic shows an animated visualization of how the cancerous lesion looks when it becomes visible on the cervix. And as we go on, I would explain, because there are situations, and more often than not, before it becomes visible to this extent, it starts out developing inside the cervix where it's not too visible. Now, other risk factors that can actually lead to the development of cervical cancer include, but not limited to, multiple sexual partners. Now, if a person actually has multiple sexual partners, it means that they are at increased risk or probability, or they have a high probability of contacting someone who has the human papilloma virus, and that puts them at greater risk of developing the cervical cancer, more than someone who actually has a single partner. Now, there's a caveat to that. Even for someone who has a single sexual partner, if that partner also has multiple sexual partners, then it puts the primary partner at risk, because the other partner who has multiple sexual partners also has an increased probability of contracting the HPV virus and then transmitting it to the primary partner, the woman. The next risk factor is, I think there's
You just like the color one.
Hello? I think a few. Great. All right. So the next risk factor that I'll talk about is weakened immunity. As I mentioned, the body does a very good job of clearing a person's system. If she's infected with the human papilloma virus, max 2 years, most of the infection would have cleared. However, if for one reason or another, a person has a weak immune system, then it makes it very difficult to fight off the infection, right? And a classical example of a person who has a weak immune system, a person living with HIV or HIV/AIDS. But it was found that women living with HIV/AIDS are 6 times more likely to develop cervical cancer. And when I say living with it, it's not just about living with it. I mean uncontrolled or untreated HIV/AIDS. And another example is a person on chemotherapy for another form of cancer, or any type of systemic infection that weakens a person's immunity, puts them at risk of developing cervical cancer, because their body then will have a hard time fighting off the infection. Another risk factor is prolonged use of oral contraceptive pills. And now, not just contraceptive pills, oral contraceptive pills. Oral contraceptive pills by itself does not cause, it's not really harmful, but prolonged taking of oral contraceptive use, and I'm talking about 5 years and beyond, right, has been associated to, or has been linked to, the development of cervical cancer. Also, for women with high number of pregnancies, so like grand multiparity, women with more than 5 children, have a risk of developing cervical cancer. Now, the interesting thing is, it is not because a woman is having a lot of children that is why she's at a higher risk or a high risk of developing cervical cancer. It's because the assumption is that with high number of pregnancies, there's an increased probability that she has multiple sexual partners. That's if all the children were not had with one particular partner. So because it's likely that high number of pregnancies to be associated with sexual partners, or increased number of sexual partners. That's why it's also a risk factor, right? And
There are some breaks in your.
There are some Oh, is it clearer now?
Okay, it's clear now.
It's
I don't know.
clearer now.
Are you using what do you call it? Earpiece?
No, it's a headset. Is it clearer now?
Yeah.
Okay, sure.
Okay.
Thank you for that. Okay. So there are some lifestyle activities that increases a person's risk for, in fact, every kind of cancer, as a matter of fact. And one of them, in fact, mainly is smoking. Smoking is linked to the development of many kinds of cancers, including cervical cancer. And since HPV, which is literally the main culprit for the development of cervical cancer, is sexually transmitted, it means that the development of an STD is also a risk factor for developing cervical cancer, because if a person has developed an STD, it means that they are engaging in a high risk sexual behavior that already has predisposed them to developing cervical, or to contracting the HPV virus, which will then lead to they developing cervical cancer. Right. So there are many other risk factors. These are the main ones. Now, cervical cancer is preventable. That's the good news. Cervical cancer is early screening and detection actually saves lives. And I think my colleague, Dr. Kelyne, will speak extensively about that. So I would leave that for her to talk about. But I just want you to know that early detection actually saves lives when it comes to cervical cancer. And so I'll leave the slide. Okay. Yes. Now, for the treatment and the prognosis, so I'll talk briefly about soft skill. Now, before I talk about the treatment and prognosis, I would like to touch on some of the signs and symptoms of cervical cancer. How would a person know that they have cervical cancer? Now, it's cervical cancer actually, when it first starts developing, right? It starts out as a precancerous lesion before it becomes a cancer. There are some changes that will occur within the cells of the cervix before the cancer becomes a fully developed cervical cancer, right? And for the most part, for the longest time, it's usually asymptomatic, and that's what makes cervical cancer very, very, very elusive. It's mainly asymptomatic, so there may be no symptoms at all to give an indication that there's something wrong. So the first symptom is it's usually asymptomatic, no sign and symptom at all. The next thing is a woman may have abnormal vaginal bleeding. So that is bleeding outside of the normal menstrual period time. 2, bleeding after sex, bleeding in the postmenopausal period. A woman who actually is postmenopausal after some time should not be bleeding at all. But if that woman is bleeding as though she were on her menses, then it also gives an indication that something might be wrong. Now, if a woman engages in sex and has pain, so pain during and after sexual intercourse is also a symptom of cervical cancer. Now, foul and offensive smelling vaginal discharge is also a symptom of cervical cancer. Other symptoms include a low back pain, swollen feet. In fact, pelvic pain. Sometimes there may be increased frequency of urination, burning sensation associated with the urination. That's probably indicates that the person has an STI of some sort. So those are some of the examples of symptoms that a person may have that may point to having, or that something is wrong, and it may be cervical cancer. It may be other things too, but these are things that should get any person worried that something may be going on. Now, so I'm going to talk about the treatment, since my colleague will talk about the detection, the screening, and the vaccination. Now, after the diagnosis of cervical cancer has been made, it's important that we stage it. Staging is just telling how far along the person is in terms of their diagnosis, or how early or how late the diagnosis is. So like I already mentioned, there is a precancerous lesion. That's before the abnormal division of cells become cancerous. There are some changes that occur that actually prove that it is developing, it has a higher risk of developing to become cervical cancer. And so that's like the pre-stage, or I would say stage 0. Then now we have 4 main stages, right? The stage 1 through to stage 4. So with stage 1, essentially the cancerous cells are confined to the cervix, right? That's stage 1. And usually with the treatment, so I'll talk about the treatment that's done there. So for those stages, surgery can be done to remove the cancerous lesions. We can do radiation therapy. We can also do chemotherapy. Now, stage 2 is the next stage. This is where the cancer has gone beyond the cervix into nearby tissues just around the cervix. And for that, surgery may be done, but chemotherapy and radiation therapy are the main modes of treatment for stage 2. Then we come to stage 3. This is when the cancer has spread to not just nearby tissues, but surrounding organs still within the pelvic region. Now, for that, when it gets to that level, we still can do radiation therapy and some chemotherapy. And the final stage is stage 4, where the cells have spread to distant organs, so the lungs, the liver, other organs. And that's what we call the stage 4. And it's a very late stage. And usually for that, we can do chemotherapy and radiation therapy to improve symptoms, but not much can be done. And we do what we call palliative care, where it's more like end of life care, helping a patient to have the best quality of life possible before, the unfortunate happens. And it's really sad to see a woman die from cervical cancer, because as I mentioned, it's very, very preventable, and so much can be done, because it takes between 10 to 20 years for cervical cancer to fully develop, right? And that's a long time, because it gives like a long time before it becomes so bad. So there's so much room for early screening and detection, for early intervention, because early detection does saves lives. So it's super important to note that. I mean, one thing I would want you to take is that it's important. Many people don't actually know about cervical cancer, and that's the issue we have in this part of our world. Many people are not aware of its importance, its significance. Like I mentioned, because even the signs and symptoms are usually asymptomatic, a person might ask, someone on this call might just ask themselves, oh, why should I be concerned about this? Great presentation. But that's the thing. Everyone, you want to be sure you're safe. You want to be sure it's not something you have to worry about. And because there's not much noise about cervical cancer, as much as there is for breast cancer, it often does not feel as urgent or as important. And there's no national vaccination program that covers for people to ensure that people are actually getting vaccinated. So these are some of the issues that we face in this part of the world as compared to developed countries, where there are national policies and strategies and programs to ensure that people are actually free from this, and then people actually don't have to worry about this at all. Yes, so I would pause here and hand over to my colleague to continue and touch on the other areas that I might have left out. Thank you.
Thank you very much, Dr.
Thank
Frank.
you.
So I'll take it from here. My name is Dr. Kelyne Nana Poku, and I'm the co-founder of Cervical Foundation Ghana, together with Dr. Frank Erzoah-Cudjoe. So before I continue the session from where he left off, I would like to share a short story. Okay, so what actually started Cervical Foundation Ghana was during the 5th year of medical school, okay, during ward rounds with our consultants, we came to the bed of a particular woman who obviously looked like she was in a lot of pain and she couldn't breathe. She had the nasal prongs in her nose and everything, but she still could not breathe. Okay. A week later, when we came back to the ward, she had passed, and we learned that she had cervical cancer. However, she came to the hospital in the late stages. And because the cancer was in the late stages, the doctors could not do much to save her. And the cancer had spread all through her body and had even gone to her lungs. And that is why she was struggling to breathe. And this really touched me because cervical cancer, as Dr. Frank said, it is killing a lot of our women in Ghana. Just imagine, like, in a year, you take 2,000 women, you count 2,000 women, and they are all diagnosed with cervical cancer. And out of the 2,000, about or more than 1,000 die from cervical cancer. And a lot of people do not know about this disease, and it's killing the women in our country. So I just want us to really pay particular attention and make sure that everything that we share here, whatever advice that we give here, we pay heed to it and do them. So I'll continue from the cervical cancer screening and vaccination. So as Dr. Frank said, cervical cancer is one of the most preventable cancers in the world. And that is why we're making noise about it. If you detect cervical cancer at the very early stages, you can actually be totally cured. And if you follow certain rules and regulations or principles, you are at a very high chance of not getting cervical cancer at all. So as I mentioned, there are 3 main screening methods for cervical cancer. Screening methods are like ways of going to check if your cervix has the cancer on it. Okay. So the first one is the pap smear test. So with the pap smear test, what is actually done is that a woman will go to the hospital and then a sample, okay, so a sample will be inserted into her vagina to take, a speculum will be passed into. Hello, please, can you help? Can you hear me? Am I audible? Am I breaking?
Hi, please, we can hear you. You're audible.
Okay, thank you very much. So a woman will go to the hospital and then a spatula is passed into her vagina to take a sample from her cervix. And then these samples from her cervix are placed under the microscope to check if the cells on her cervix have become cancerous. And that is the papilloma, the pap smear test. Pap smear test is not painful at all, but it's a little bit uncomfortable because you go to a doctor and just like if you are pregnant and they are doing a vaginal exam and everything, they will open you up and then pass the speculum and then take a sample from your cervix. And that can be a little bit uncomfortable, but it is not painful whatsoever. That is the pap smear test. After the test, depending on where you want to do the pap smear, the results may take like 3 days to 2 weeks. Then they'll be able to tell you if you have the cancerous cells on your cervix or not. Another type of screening test is the HPV testing. So HPV is human papilloma virus, and it is the virus that has been associated with 90% of cervical cancer cases. So it means if you get persistently infected with the HPV virus, your chances of developing cervical cancer is high. So the HPV test is to test if you have the HPV virus on your cervix. So the process is very similar to the pap smear test, where you go and a spatula is passed and a sample is taken from your cervix. And it is also viewed under the microscope to see if they will see the HPV virus on your cervix. The last one is called the VIA, which is visualization in acetic acid. Okay, that one is usually done in resource limited areas, like those rural areas where they do not have maybe a pathologist or a lab to do the pap smear and the HPV testing. So with that one, usually midwives do it. They will pour acetic acid on your cervix. They will smear it on your cervix and they will look at it after some time. And if you have cervical cancer, there's a certain way that it will look. And if you do not have cervical cancer, there's a certain way that it will look. And I want us to know that when you go in for this test, ideally, according to the WHO, if you're a woman between the ages of 21 and 65, you are supposed to do the pap smear test every 3 years. So it means if this year you go and do your pap smear test and then you are declared cervical cancer free, you don't have to do another test till the next 3 years, just so you make sure that you are free from cervical cancer. That is for the pap smear test. And the HPV test is done every 5 years. So you do it this year and you have to wait another 5 years to go and do the next one. And there are situations whereby it is recommended that you do both of them. So you do the pap smear to look if there are cancerous cells on your cervix, and you do the HPV to check if you have the HPV virus on your cervix. And it's usually recommended for very older women around the age of 65 and people who have HIV. That one, the two of them, you do it every 5 years. So that is with the cervical cancer screening. It will interest you to know that the cheapest of the tests is the VIA. As I said, it's usually done in rural areas where they don't have those sophisticated materials, and so it is relatively cheaper. I know that Marie Stopes Clinic, they do the VIA, and it's just 65 cedis for the VIA. The pap smear ranges, depends on where you go and do it, but the price ranges from 100 to 200 Ghana cedis, and the HPV is more expensive. I'm not very sure of the price. So this is to let you know that it is very, very, I know we all have different pockets here. However, relatively, the prices of the HPV screening, the cervical cancer screening are very, very affordable. And I believe that in order to protect yourself, going in for these screenings just once every 3 years and once in 5 years will really, really protect you or your loved ones from cervical cancer. So that is with the cervical cancer screening. Cervical cancer screening is ideally for women who are sexually active. So if you've had sex before, that means that you have most likely been exposed to the HPV virus before. Because as Dr. Frank said, the HPV virus is very common. About 80% of people who have sex have the HPV virus. So that is why, once again, you have a high risk of developing cervical cancer if you have multiple sexual partners and you are very sexually active. Now, coming to the HPV vaccine, we have a vaccine to prevent or to protect you against HPV. The vaccine research has come or has suggested that the HPV vaccine is effective in people who are not sexually active. So that is the weapon that those in the Western world are using to protect their women, okay? Where their children from the age of 9 years to 14 years, even before they start having sex, are vaccinated with the HPV vaccine. Now, although although cervical cancer affects women, because it is women that have cervix, right? That have a cervix, the HPV virus can also be present in a man. So although a man does not have a cervix to develop cervical cancer, he can harbor the HPV virus, and he can also transmit it from women to women if he has a lot of sexual partners. And another thing too that Dr. Frank mentioned is that the HPV virus has a lot of strains or a lot of types. We have HPV-6, HPV-11, HPV-16, HPV-18. It's just the HPV-16 and HPV-18 that have been associated with cervical cancer. However, other types of HPV are associated with other conditions. So research has suggested that anal cancer, which can affect men, throat cancer, which can affect men, genital warts, which can affect men, have all been associated with other strains of the HPV vaccine. So if you're sexually active and you're not protecting yourself, you're not practicing safe sex, whether you are a man or a woman, you are in danger of the HPV virus. It's just women that may develop cervical cancer. But if you're a man and you don't protect yourself and you are reckless with your sexual life, you may have the HPV virus, which may develop into anal cancer, throat cancer, and other forms of diseases in your body. Now back to the HPV vaccine, because men can also transmit the HPV virus. In the Western world, they not only vaccinate their teenage girls, they also vaccinate the boys as well. So that when you vaccinate the boys, you are protecting them against those anal cancer, penile cancer, throat cancer, and you're also protecting them from transmitting it to other girls. So it's like a double-edged sword. That is one of the weapons that those in the West, the countries of the West, are really using to win the cervical cancer battle. Now, in Ghana, the good news is that the HPV vaccine, is available in the country. However, the bad news is that it has not been enrolled on the national immunization schedule, and it is not supported by the National Health Insurance. So that means that if you want to get vaccinated, or if you want your daughter or your wife or your sister or whoever to get vaccinated, or if you're a man and you want to get vaccinated yourself, you have to pay out of pocket. Now, the WHO recommends that you need 3 shots of the HPV vaccine to be fully vaccinated. And in Ghana, one shot of the HPV vaccine costs between 950 Ghana cedis to 2,000 Ghana cedis. And that is quite pricey. Although it is very, very efficient if you're able to gather the money to get 3 shots. So as I mentioned, it's between 950 to 2,000 Ghana cedis. So you can do the math. You need 3 to be fully vaccinated and 950 to 2,000 per shot. So although that is on the higher side in terms of money, it's very worth it, because when you get cervical cancer, the cost of treatment and everything that encompasses treatment of cervical cancer is like 10 times more than getting the vaccine. So I entreat that if you are not sexually active, if you have a child who is not sexually active, I recommend the HPV vaccine for them. And if you are sexually active, I recommend getting screened with the pap smear HPV or the VIA. So basically that is all about cervical cancer and the HPV vaccine. I think Dr. Frank has spoken about treatment of cervical cancer. So on that note, I will end here. And if you have any questions to ask, any clarifications, you can definitely ask, and we are willing to answer. Thank you very much.
All right, thank you very much, Dr. Nana Poku. Hello, please, can you hear me?
Yeah, so sorry. I think I forgot one thing. Let me just do it fast. Okay, just like 2 minutes. So I think I didn't speak about prevention of cervical cancer. So it's simple. You just know the risk factors and avoid them. So we know that the primary cause of cervical cancer is the HPV virus, and the HPV virus is sexually transmitted. So that means that if you're sexually active, you should practice safe sex. Make sure that if you have one partner, that partner is faithful to you, and you are faithful to that partner. If you don't trust your partner, make sure you use protection, that is a condom, during sexual intercourse. That is for the HPV virus. Now, for the other forms of causes or risk factors, such as smoking, once again, you have to stop smoking. It does not help you in any way. If you are on oral contraceptive pills for a very long time, like you've been using it for like over 5 years, I would advise you pause and then switch to another form of family planning, because as I said, prolonged use of oral contraceptives have been associated with cervical cancer. Same with weakened immune system. So as Dr. Frank said, people with HIV, people with diabetes who are not taking their medications have a weakened immune system. And that means that when you get infected with the HPV virus from having sex with someone who has the HPV virus, your body is not strong enough to wash off or fight the HPV virus, and it has a very high chance of leading to cervical cancer. So if you have any of these conditions that I have mentioned, make sure you take your medications, you adhere to all that your doctor has instructed you, so that your immune system is built. And if perchance you get infected with the HPV vaccine, your body can fight against the vaccine. Yeah, I think basically that's how you can protect yourself and your loved ones. And of course, getting the vaccine if you're not sexually active, and also going for screening to know your status, whether you have the HPV virus or not, to protect others. Thank you so much.
All right, thank you very much, Dr. Nana Poku and Dr. Cudjoe. That's a wonderful presentation. I wanted to ask, in your presentation, you mentioned the prices. I realize that the range is very high, between 900 to 2,000. What accounts for that? Is it due to whether you get it from a government hospital or from a private hospital? And the second question too is, in terms of the vaccination, where can you get a vaccination? Do you have any list of hospitals that you can go and get a vaccination being done?
Okay. All right. Thank you so much. Yes, there's something that accounts for the different prices of the vaccination. Now, as I mentioned, or as Dr. Frank mentioned earlier, there are different types of the HPV virus. There are over 100 types or strains of the HPV virus. And the vaccines there are different types of vaccines on the market. And the price of the vaccine, or then even the name of the vaccine, depends on how many strains or how many types of HPV that vaccine protects you against. So we have for example, we have a vaccine called, I think, Gardasil 4. That means that vaccine has the capability of protecting you against 4 of the multiple strains of HPV. Then the most expensive and the most current one on market is Gardasil 9. That means that it has the chance of, or it has the benefits of protecting you against 9 of the HPV types. And the more HPV types a vaccine can protect you from, the safer you are, because apart from cervical cancer, as I mentioned, we have anal, throat cancers, and all other types of cancers that HPV can bring about. So it means the higher the number of HPV viruses or HPV strains a vaccine can protect you from, the pricier it is. So the 2,000 cedis is usually for the Gardasil 9, which is the most current one on the market, and it protects you from 9 of the HPV virus strains. We have, and the 950 will most likely be for the Gardasil 2, Gardasil 4, the ones that just protect you against 2 cervical cancer strains, and then 2 HPV virus strains and 4 HPV virus strains, respectively. And also, of course, the factor of where you do it matters. Private hospitals may have a slightly higher price, but the huge factor that accounts for the wide gap between the price is the type of the vaccine that you go for. Now, for the I'm so sorry, the second question, can you kindly remind me of what you said with the second question?
The second question was where you can get it, the vaccination, which hospitals can you get a vaccination being done?
Okay, thank you so much. So currently, yeah, thank you very much. So currently, we're still putting together a list of hospitals where you can get the vaccination and even the pap smear test done. You can check our social media platforms, Cervical Foundation Ghana, on Instagram, Facebook, LinkedIn. You will find us there. And if you follow our page, if you look at the content, you will learn so much about cervical cancer, and eventually we'll put the list on there. But there are some that I can mention. There are some places that I can mention. I know Marie Stopes. Okay, they offer both the vaccine and the pap smear test. I know Rage Hospital, they do the vaccine and then the pap smear test. I know of Achimota. I know of Kolebu Teaching Hospital. So basically, like the regional hospitals, like the big hospital, for lack of a better word, you most likely find both the vaccination and the screening being done there. But for private facilities, I personally know of only Marie Stopes. But we're still investigating, we're still asking the hospitals, and we will definitely come up with a compilation of all the places that offer the vaccine and the screening according to region, like based on the region, so that you know the nearest one close to you and you can go for it. But it'll be available on our social media platforms. So just look out for it. Cervical Foundation Ghana on Instagram, LinkedIn, and Facebook. So yeah, that's what I can say about where you can find some Kolebu, Achimota, Rage, Marie Stopes, any Marie Stopes clinic around you. You can get the vaccination and the screening. Yes, please. Yeah.
Okay.
Basically,
all right. Thank you.
Thank you too.
All right. Thank you very much. So yeah. So once we are waiting for other questions, if you have any question, kindly raise your hand, then we'll call you. Or if you want to share it through chat too, you can also do it. My second question is, does cervical cancer affect fertility?
Dr. Frank, please, would you like to take that? Or I should take it?
Hello. Please, am I audible?
Yes, please, you are.
Okay, thank you. So cervical cancer can affect fertility in some ways. So I'll talk about a few of them. And the first thing you should take note of is it depends on the stage. As I mentioned, there are several stages. There are 4 main stages. That's outside of the precancerous lesion. The first way cervical cancer can affect fertility is the type of treatment that is used in treating cervical cancer. Now, some stages would require the removal of the uterus or the womb. And obviously, if the womb has been removed, then it limits the chances of having, without a womb, then there can't be fertility when there's no womb. So that's one of the ways, right? The surgical treatment, that's like if it gets to that point where the uterus has to be removed, maybe because that's spread to the uterus or something like that. And two, with some of the therapies that are used, like the radiation, it can sometimes damage the ovaries, right? Which may lead to some early menopause and may cause infertility, and it might even make pregnancy difficult or risky. That's if radiation therapy is used. However, that can be discussed with the primary caregiver or the physician. And so that's something that's when it gets to that, the doctor will take you through. And also, some of the procedures involve taking sections of the cervix. Some of the screening programs actually, and even treatment modalities involve taking some samples of the cervix. And if sufficiently large samples are taken, it might actually lead to some forms of scarring, which may make it hard for the sperm to reach eggs for fertilization to occur. And as we mentioned too, the cancer can spread. So if it spreads to nearby reproductive organs, it can affect the function of some of these organs. But there are options that can be considered for fertility in women who have been diagnosed with cervical cancer. So there are egg or embryo freezing. There's also options where there's something called ovarian transposition, where the ovaries are removed away from the radiation fields to reduce the impact the radiation has on the ovaries. So yeah, there are also fertility sparing surgeries that can be done that might make it possible to still have children. So it can have some effects, and depending on based on whether treatment or the condition itself. And once again, every woman or every case is different. So depending on the type of or the stage or how far along the cancer is, solutions can be reached together with the doctor to decide how best, if a person has reproductive wishes ahead. Yeah, thank you.
Okay, thank you very much. I can see about 2 questions on the chat. I don't know if you can check and answer it for us. We're very happy.
Oh, sure, please. Okay.
I think I want to answer the first one. Says that, please, what's the pathophysiology of oral contraceptive pills with cervical cancer? And can a family planning method like IUD cause cervical cancer? So let me answer the IUD one first. So no, IUD and other forms of contraception, family planning have not been associated with cervical cancer. Now, how oral contraceptive pills have been associated with cervical cancer is still something research is still ongoing about. But the theories that have been propounded is that oral contraceptive pills, okay, sort of increase the persistence of the HPV virus on your cervix. Let me explain. So as I said, this is how cervical cancer develops. You get infected with the HPV virus. Ideally, if you're a very healthy human being, your body is able to clear the HPV virus from your system very early, and you are back to normal. However, if your immune system is compromised or you are living a lifestyle that's smoking, not eating healthy, not exercising, it makes it difficult for your immune system to fight that HPV virus that has been found in your body. And oral contraceptive pills have been associated with increasing the persistence of HPV. So it means that it makes it difficult for your immune system to wash, for lack of a better word, wash off the HPV from your system so that it doesn't lead to cervical cancer. That is one of the main things that have come up with research in terms of oral contraceptive pills. And another thing too that has been associated with oral contraceptive pills used in cervical cancer is that most women that are on oral contraceptive pills, like most people take oral contraception primarily to protect themselves against pregnancy, okay? And they forget about the sexually transmitted disease part of protection. So it means that if maybe she's going to have she has multiple sexual partners. She thinks that because she's on oral contraceptive pills, and that one is very easy to acquire, unlike maybe IUD where you go and they'll have to insert it and everything. Oral contraceptive pills, you can just go to any pharmacy, over-the-counter pharmacy, and get some instantly. So that's one of the most commonly used form of family planning. Let me use that word. And because of the fact that the lady knows that taking in the oral contraceptive pills, she's protecting herself from pregnancy, she will not encourage her male partner to use a condom. And if she has multiple sexual partners, it means that she's not using a condom during each of the sessions. And that increases her chances of getting STDs and HPV because you're not protecting yourself. I don't know if I'm making sense. Because they think that taking the contraceptive pills is protecting them from pregnancy, they forget about the STD aspect of protecting yourself if you have multiple sexual partners. And that increases your chance of getting the HPV virus, which may develop into cervical cancer later. So yes, oral contraceptive pills sort of causes the persistence of the HPV virus in your system. It doesn't allow your immune system to wash it, lack of a better word, away from your system as frequently as not being on oral contraceptive pills. So I advise that if you plan on not getting pregnant for a long time, the best, like 5 years plus, the best family planning method, you should go for the others and sort of leave the oral contraceptive pills as well. And another thing too is that the hormones in oral contraceptive pill, that's the estrogen and progesterone, they also sort of make the environment of your cervix favorable for the HPV virus to persist on it so that it will develop into cancer later. So that's how oral contraceptive pills have been associated with cervical cancer. Thank you very much.
Thank you.
Hi.
I think there are more questions on the chat.
All right.
Hello. So, can I come in?
Okay, is it Dr. Cudjoe?
No,
No,
because
this
I
is
was about talking, but someone was speaking. So.
this Admarco, I want to come in. Just add a little thing, few things.
So
Yes.
this is Dr. Adumako, right? Okay, thank you.
All right. So because this is an educational platform, I'd like to add a few things. I don't want people to leave this platform with the message that oral contraceptives can cause cervical cancer. Like Dr. Poku said correctly, it's been associated with cervical cancer. And in research, association does not necessarily imply cause. Okay, like she's mentioned some of the possible propounded theories, which are correct. One thing I want to mention is that with the association, it's also been shown that whenever you do stop the oral contraceptives, your risk returns to the risk of someone who has never used it. So oral contraceptives are safe and they can't be used. Anytime you do stop, your risk returns to someone who has never used it. The best bet is to continue having your routine screening as if they are preaching. A little thing to add to is that the HPV virus is spread from skin to skin contact, and condoms do not give you 100% protection because the condom does not cover the entire genitals. So even with the use of condom, you can have HPV spread. So your best bet for cervical cancer prevention is routine screening and vaccination. Thank you.
Thank you so much, Dr. Adumako.
Hello.
Yeah, hello.
Am I audible, please?
Yes, this is Dr. Cudjoe, right?
Yes, please. This is Dr. Cudjoe. Erzoah-Cudjoe. Okay, so I think I still see some questions there. I'll address it. So I think Vivian is asking if men can also be tested for HPV. Well, I would say that men can be tested. However, there's no routinely recommended HPV testing among men. I mean, no each FDA approved HPV test for men, right? But there are some special cases where doctors may use something anal pap smears, but that's for men who are at high risk. But it's not something that's actually really, really done. like we said, HPV can cause other lesions, so like warts, genital warts, and all that. So those are some of the things that may be inspected visually to see if someone actually has the HPV, or biopsies cannot be taken of, certain lesions to check for the HPV, but it's mostly prevention when it comes to men, right? And men too can be vaccinated. In developed countries, men alongside women are being vaccinated because, like we said, men can transmit the virus to their female partners, and so those are some of the things that are done for men. And I think another question is if abdominopelvic ultrasound can be used as part of screening. Well, they are not primary screening tools. As Dr. Kelyne has mentioned, there are some primary screening tools for cervical cancer, like pap smear and then the HPV test. However, certain imaging tests or studies can be done, like the ultrasound. They in fact, they may be helpful, like if you want to assess the tumor, like you said, the tumor has a stage, right? But if you want to also visualize the size and the spread, in fact, there are better scans for that, CT scan and all that, MRI. But yeah, you can use it, but it's not really a primary screening tool. I think that's the main thing that I would say. Because cervical cancer has precancerous lesions, right? So usually these screening tools do not become too necessary unless it's a very late stage. So when it comes to screening, in short, there are better ways of screening for the lesion, right? So yeah, those are the questions I've seen so far. Someone said about 2 years ago, I did a cervical screening. So please, can I do it again? Okay, so like Dr. Kelyne mentioned, the golden tip when it comes to screening is of increased frequency. You see, the advantage that screening brings is when you keep regular screening, that is what increases the sensitivity of the screening picking up cervical cancer or the precancerous lesion. And so, as a matter of fact, that you've gone for one screening is not enough. And like she mentioned, there are various screening modalities, and they all have frequency or recommended frequency. So if you do HPV testing, for example, it's every 5 years. If you do the pap smear, it's every 3 years. If you do co-testing, which is the best, that's HPV and the pap smear, it's every 5 years. So it's not about doing it once, it's about just being screening regularly so that if there are, because the fact that it wasn't detected a few years ago does not mean the risk for developing it has reduced. So your safest bet is regular screening. I think these are the main questions. Okay. Well, welcome, Vivian. Those are the main questions I see. I think for the implant question, Dr. Kelyne has addressed that. So yeah. There are any more questions? We're still open.
All right, thank you. So we'll still wait for some few minutes, probably about 5, to see whether we still have some questions. If not, we will end our session. So if you have any question, kindly come up with the question so that our doctors will answer you. So whilst we wait for the questions, so it means when you do the vaccination, is it for life? Or you have to do it after every 5 years, as you said? Or the 5 years is just for the screening?
Hello.
Yeah, hello.
Okay, so like the screening and the vaccination, they are different. So what I was referring to was the screening methods. That's trying to pick up if a person has started developing the lesion. However, for the vaccination, it's not necessarily for life, but it provides, the studies have shown that it provides protection for about 10 to 15 years, without it significantly waning. So yes, that's the difference. There's a big difference between the screening, which is supposed to be done regularly, and the vaccination. Okay. I don't know if that answers your question.
Yes. It does. Thank you very much. Yeah.
You're welcome.
Yes.
And once again, the vaccination has been proven effective among a particular age group. That's 9 to 14 years. I think Dr. Kelyne mentioned it. So it's usually given to people because it's believed that by then they shouldn't have had any ideally sexual experience. But they are for people who already have had sexual contact. There's their catch up vaccinations that are done up to age 45, because it's believed that, yes, we have different strains of the HPV virus, but if the person has had a sexual encounter, it doesn't necessarily mean that they are necessarily free. The vaccination still provides protection from the high risk one. So the person might have already contracted HPV, but doesn't mean they might have had the high risk one. So yes, so I think someone was also asking, where can the vaccination be done, please? Okay, so like we said, we are putting together a comprehensive list, but there are a few places where they come. I know major hospitals, regional hospitals. I know of Kolebu Teaching Hospital, they do the vaccination. I think Dr. Helen can help us with more places. And which types of contraceptive causes cervical cancer? Okay, so I think Dr. Kelyne has spoken about this, and someone also helped with Michael Adomako to help. So but just to recap that. So in my presentation, I spoke about risk factors, right? So it's a cancer. So you can't point to one thing as causing it. There are things that increases a person's risk of developing it. So is the prolonged use. We mentioned a risk of develop with the contraceptive. We mentioned, I clarified that it's prolonged use of oral contraceptive pills that have the risk of, or that brings or carries the risk of developing, making a person develop risk cervical cancer, and there are studies to show that. So yeah, that was the particular one, the oral contraceptive is for, and like I said, 5 years or more. Yeah, it's usually the time period that's given. Okay, I think those are the. Oh, you're welcome, Victoria. Okay, Dr. Kelly, if you could kindly help us with more places where the vaccination can be given.
Sure, I can. So I mentioned for the private facilities, we have Marie Stopes Clinic, any Marie Stopes clinic near you, and they do both the vaccination and then the screening as well. I think the screening, they have the VIA, which is very affordable. It's 65 cities that I have asked and confirmed, and the Pap smear and the HPV, I think they do that as well as the vaccination. And for hospitals, that's government hospitals. I know of Kolebu, Rage, Achimota. Yeah, I think Kolebu, Rage, and Achimota. They are the ones that I personally know. But definitely, if you walk into any government hospital, even if they do not they do not give the vaccine and the screening, they can point you in the right direction. So just walk into the nearest health center. But I also mentioned that you can be on the lookout on our social media platform, Cervical Foundation Ghana. We are working on compiling a list according to regions where you can get the vaccination and the screening done. So yeah, you can also find that an extensive list as well. Thank you.
Thank you. And I think I know Batotu, there is a comprehensive cervical cancer program there. So someone is asking if, okay, high pregnancies cause, okay, once again, high number of pregnancies, like I said, is linked to the risk of developing cervical cancer, not because of the number of children or the number of pregnancies per se, but there is an intrinsic assumption there that high number of pregnancies is likely to be from multiple sexual partners. So I think I mentioned that. So it is from that angle that is linked to cervical cancer, not just because of, the number of pregnancies in itself, although trauma to the cervix and all those things may contribute to the development of the abnormal growth of cells. But once again, it's not really about the number of pregnancies, but it's because there's an implicit assumption that if a person has a high number of pregnancies, it's likely to be from multiple sexual partners. So for a person with a single sexual partner who does not have multiple sexual partners, there isn't that much of a worry there. I hope that answers your question. Salome. Okay, these are all the questions I see.
Okay, thank you. Thank you very much, Doc, for this wonderful presentation, Dr. Nana Poku and Dr. Cudjoe. Yeah, so those who are not part of our WhatsApp group, you can go to the chat and click on the link and you can join the WhatsApp group. In case you have any additional questions that comes up, you can ask and I'll make sure that Dr. get with the answer and I'll send it to you. So kindly note that this presentation is brought to you by Vivagest. Vivagest is a super supplement for pregnancy. It's been taken for pre-conception to breastfeeding. Vivagest will be available in Ghana pharmacies by 28th of February. So you can feel free and go to our various pharmacies and go and get your Vivagest. Vivagest is supplied by a company called Hoffman Laboratories, and Vivagest will be distributed by a very great pharmacy called Gokas Labros. So thank you very much, Doc, for this wonderful presentation. I think we did this presentation together with Cervical Foundation Ghana. You can go to LinkedIn. You can also go to Facebook. Are you on Facebook?
Yes, please. We are.
Okay. Probably let's spend about 1 minute and just share where people can locate you before we close, where people can locate in case they want to have any information on social media.
All right. Thank you for the opportunity. So we are on most of the social media platforms. We are on Instagram, we are on LinkedIn, we are on Facebook. I'm trying to see if I can share the link to our profiles in the chat so that will be very easy to reach us. Yes, so I think I'll do that before the meeting ends.
Okay. And those who are also on our WhatsApp group, you can share with me so that I can also share it on our WhatsApp group, so that those who want to go there to learn more can have the opportunity to do that. Yeah.
Okay, that's perfect.
All right. So thank you very much once again, our two doctors who did the presentation today. And of course, also thank you to Dr. Adomakon. Dr. Adomakon is a medical doctor at Rich Hospital, Ops and Gyne department. I hope you are still there. Yeah, so thank you very much. We are really appreciative of your contribution that you did for us today. So next week, God willing, we'll be back again for another presentation, most likely to be at 4 p.m. through Zoom, our usual time. So I will give you more details on our various platforms, social platform, WhatsApp, Facebook, on LinkedIn, to let us know about the topic and the medical doctor that will be giving us the presentation. So thank you very much. We are very grateful that you took the time to join us on this presentation. I know you have a lot of things doing, but you decided to join us from this 7 o'clock to almost like getting to 8:30. We are very, very grateful. So we'll meet again, God willing, next week. But as I said, you can check on the link, click on the link and join our WhatsApp group. Doc2 will also share some other links there where you can also click it and get it. In case you're not able to get those on our WhatsApp platform, I will share those links and you can join us there. So thank you very much and enjoy the evening. We'll meet, God willing, next week for another presentation. Thank you. Goodbye.
Bye. Goodbye.